Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about neuroinflammation, inflammation of the brain, and diet. What types of foods may create neuroinflammation, right? Now, there are many different types, and there's individuality with diet in terms of what might be causing a patient a problem. Some people, it might just be like food coloring or an artificial sweetener, or they might be allergic to eggs. But in general, there are a few categories of food that tends to create inflammation for a majority of the people who have issues with their brain function, fatigue, or depression, right? So when we look at patients, we look at diet. So when we look at the first category, when we have inflammation, we want to make sure that we're not taking in excessive sugar. Sugar can be highly inflammatory because one, it creates insulin spikes and then followed by cortisol spikes. These types of spikes will create low-grade inflammation, can be systemic, all right? So high sugar diets can create inflammation, and it also can create glycation, meaning it will bind to different tissues like hemoglobin and so forth, and it creates an environment where it creates more damage to the tissues, like your arteries, right, or your pancreas, or your kidneys. So a high sugar diet is one of those things that you need to avoid when you have brain fog, concussion, ADD, ADHD, and those types of things. The next category of food is gluten. Now, I spoke about gluten many times in my other videos, but basically gluten is a hybridized wheat. It is highly used with pesticides and herbicides. So what happens with gluten is gluten protein is not your old native gluten or wheat products. It's been hybridized, it's been changed, and it's been sprayed. So this gluten protein, or gliadin, or transglutaminase, which is enzymes in your body that break down or deglutinate the protein, or deaminate the protein. The gluten, it can be highly inflammatory. The next one is dairy. So I know there has been a big marketing push in the past about how dairy is good for your body. Essentially, dairy has high calcium and so forth, but so does a cup of broccoli. So if you have issues with brain fog and GI issues and so forth, it's probably important to avoid dairy. I find connections with dairy and asthma in children, dairy with GI issues or bloating. So if you can just avoid these three categories of food, you can do your brain good, right? Instead of the body good with dairy, you can do the brain good by avoiding those three types of foods. Next over here is, what can you do to help support inflammation in the brain? So I have a very rudimentary picture over here of the brain, and it's on fire, it's inflamed. What types of nutrients can you take to help dampen the fire? Now, it's very important that you do the food categories first, because that is the foundational piece. However, there are things like apigenin, curcumin, resveratrol, catechins. Right? Catechins are from green tea, resveratrol from grapeseed or grapes, from turmeric or celery seeds and so forth. So it's important to dampen the inflammation, right? Because if you don't dampen the inflammation, the brain function will not return. Other things you can do is vitamin D, right? Vitamin D is chronically low in a lot of patients. Short chain fatty acids are very important. Acetate, butyrate, propionate. These short chain fatty acids become fuel for the gut. And it's been shown in studies to heal leaky gut, right? So it's important to do this. Glutathione, a high dose of glutathione will be very beneficial for dampening oxidative stress to the brain. Another one is DHA, right? Things that are found in fish oil, good oils, right? When you look at omega-3s, there's an EPA and a DHA. The EPA has dampening effects for global inflammation, But DHA is highly specific for the brain and nervous tissue. So if you have a high dose of DHA, it can be helpful in dampening the neuroinflammation, right? So let's just take a general look. Avoid these types of foods. Take these supplements to help dampen the brain so you can prevent further damage. Once the damage is stopped, then you need to say, okay, what else can we do to help a patient? The next step is connectivity, plasticity. How do we connect the left and right brain, the cerebellum to the frontal cortex, right? How do we improve brainstem function with autonomics and so forth? So it's very important to look at inflammation, not in just terms of dampening it or reducing inflammation, but also looking at connectivity. How do we connect the brain to function better overall, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.